Good afternoon, welcome to today's Health and Wellbeing Board. I'm going to start out by getting people to introduce themselves. So, have we got anybody online? Nobody online?
Not at this moment.
No, okay. So, everybody's in the room. We'll start with Warren, the Vice Chair.
Hello, I'm Warren Gillibrand. I'm the Head of Nursing at the University of Huddersfield and Deputy Chair of the Board.
Good afternoon, I'm Tom Brailsford. I'm Executive Director for Children's Services.
Hello, I'm Carol Patterson. I'm the, I'm the leader of the council.
Good afternoon, I'm Julie Sykes, Independent Scrutineer for Kirklees Safeguarding Children's Partnership.
Hello everybody, I'm Emily Perry-Harris. I'm Consultant in Public Health at Kirklees.
Hi, I'm Catherine Riley and I'm from Calderdale and Huddersfield Foundation Trust.
Good afternoon, I'm Steve Brennan. I'm the Director of Partnership Development for the Kirklees ICB.
Hi, I'm Liz Mear. I'm Chair of the Kirklees Health and Wellbeing Partnership Committee.
Hi, I'm Rachel Spencer-Henschel. I'm the Director of Public Health for Kirklees.
Hi, Michelle Cross, Exec Director for Adults and Health.
Is that with you, Vicky, at the back?
Afternoon, I'm Vicky Dutchburn. I'm the Interim Accountable Officer for Kirklees ICB.
Hi, I'm Claire Groves and I'm the Services Manager for Change Grow Live Kirklees, the Adult Drug and Alcohol Treatment Services.
Hi, I'm Alistair Brown, Chief Executive with Kirklees Active Leisure and here representing Third Sector Leaders Kirklees.
Hi, I'm Karen Jackson. I'm the Chief Exec at Locala and I represent Community Services.
Hi, Hi, I'm Jo Lawson. I'm Chair of Health and Adult Social Scrutiny Panel.
Hi, I'm Sharon Laran. I'm here representing Health Watch.
And to my left?
Alex Chaplin, Strategy and Policy Officer at Kirklees Council.
Jenny Bryce-Chan, Governance Officer.
And I'm Councillor Beverly Addy, and I am the portfolio holder for Adult Social Care and Health, and the Chair of the Health and Wellbeing Board. Welcome to everybody today. Do we have any apologies?
Chair, we have apologies from Sean Rayner, James Cregan and Christine Fox.
Thank you. And the minutes of the previous meeting, could we approve them as a correct record? You pass those, Warren, and seconded by Tom. Thank you. Does anybody have any interest to declare in the meeting? None declared. And everything on this part of our agenda is for the public, so the public are welcome to attend, and it will be screened on YouTube. Do we have any deputations or petitions?
None received, Chair.
Any public questions?
Again, none received.
Thank you. So, our first main item on the agenda is item 7. If you were here at the November Health and Wellbeing Board meeting, we'll remember that in the private session, colleagues from Kirklees Active Leisure presented their targeted health and wellbeing initiatives, and these programmes are designed to reduce health inequalities, support the NHS by alleviating demand and improve overall health outcomes. So I, as the Chair, encourage people to look at how they might engage with that from their own staffing point of view, and how they might look to take up healthy options for staff to look after their own health and well-being, join activities, such as the after-work badminton sessions we've seen at the CHFT. And I'm just looking for some feedback today from partners as to what you might have managed to achieve in those directions. I did know a couple of people had something to say, so... Liz, thank you.
So I can just pick up on that. We're now, for the staff in the Kirklees Health and Care Partnership, we're now sort of linking this through like an induction off to them that we can link through to Cal and see what's on offer and join up. I think one question that we had, sometimes if you're a member of a corporate body, you would get a discount for joining, so it gives you an extra incentive, and especially nowadays when people are short on money. And we just wondered if that was possible or if that was happening.
Oh, I didn't know we were coming back to challenge Cal on such things
sorry,
today. But
well, I'm not,
I think
not challenging.
some of the
It's just
with rising costs mean that we have to look at a means of funded membership that covers your costs. But do you want to respond, Alistair, at all?
Yeah, it wasn't a challenge. It wasn't a challenge because we know it's a great service.
Can I just say no? No. To be honest with you, there's a number of different angles on this. I think, as Councillor Addy touched on, I think we've had some well-documented financial pressures in the past, and we've been tasked by the council to be commercial. We're trying to be as commercial as we can be in certain areas. Our membership offer has been simplified to now simply be peak and off-peak rates that we offer. That happened in December, so we're trying to be fair to the whole community, and we don't really offer any discounts across the board. They've been suspended there.
But I can say you have a very good price anyway, because I've joined myself and my son, so we know your pricing is very fair.
We think it provides excellent value for money, definitely, if you use the centres. The other issue that we're finding is that the centres are fairly close to capacity. So we're in a nice situation that we don't have to focus on encouraging volumes to come in, but we have to focus on making sure that we can still afford to pay the bills with national insurance increases, funding pressures as well from various angles as well that we continue to face.
Thank you, Warren. So we were looking for our positive feedback where we're doing stuff ourselves in-house, and obviously with the health need in very specific cases, you can tap into Carol, but I know you've got some exciting stuff happening, Warren.
Yeah, and just to say I'm happy to share with the board members what I've already shared around our staff wellbeing framework that we use at the university, and we have enjoyed a long and fruitful relationship for our staff members and students with Kirklees Active Leisure, which are integral to how we deliver that on campus as well, so that's very positive for us actually. So we tend to approach wellbeing, health and wellbeing in various different ways, particularly around mental health and then physical and well-being. There's a whole raft of things that are all we provide free, yeah, to at the point of contact to staff and students, of which that's around about 30,000 people, you know, in this area. So it's a significant impact. Just some examples. We have a whole range of social sports, including cricket. Yeah, Councillor, yeah, futsal. New ones, these might be new to you. Pickleball. Pickleball, yeah, it's really good. Yeah, it's a bit like beach ball, but over a net. You know, paddles. Yeah, table tennis, squash, walking events, archery. There's a whole range of free activities in terms of physical, mental health. You know, we have choirs, musical events, book clubs, menopause support group. We have a regular wellbeing fair which anyone can attend, yeah, where we highlight all of these different things. We have a return to work for parents support group as well. We also do a lot of signposting as well. One that I'm currently enjoying is with some of my estates colleagues is Latin dance with Zumba. There you go. That's the most extreme example I can think of in terms of free physical activity events in the university.
That sounds fantastic, Warren. We pitched this out because, of course, we represent some of the biggest employers, and if we can lead the way in encouraging our staff to take sport maybe, move more even, to socialise, which actually bolsters up that mental health support. Rachel?
Yes, thank you, Chair. So we've got quite a few initiatives going on. We've recently run an active travel survey for our staff to get a sense of what would help them to actively travel, because obviously it's not just exercise during the work day and after work, but how can we incorporate it in getting to and from work? So we'll use those findings to inform how we can support staff more effectively to active travel. We have quite a lot of staff networks across the council, and what we find is that they tend to set up things like walking groups or other sort of activity groups, which is really helpful as both a connection with their colleagues, but also as a way to improve physical activity. And obviously the change in seasons definitely helps with that kind of thing. In the council, we have 2 volunteering days a year for all of our staff. And some of the staff and teams will take that as an opportunity to raise money for charity, for example, as well as volunteering in the more physical sort of activity type settings, not just sort of the more sedentary ones. So again, the more we can see that, I think the more that reinforces the message. We're obviously quite privileged in the council to have our own wellness service, which is obviously very much that kind of public health delivery arm to try and help people identify what they need to or want to improve for their health and well-being and how we can tap into that. And they would refer people into Carl on the back of that. But certainly what I've asked on the back of the conversation we had last time is whether, given we spend such a lot of money on interventions for anxiety and mental health, how can we be more creative about the solutions that we offer so that we're not just, I mean, counselling obviously has a really important place, but in terms of prevention, how can we actually get people more active, which might then prevent them needing that? But if we do intervene early, can we get them into some of that physical activity offer locally? So we've got more to do, obviously, like everybody does, but we have got quite a lot going on, and clearly we'll carry on working with our staff to understand what it is that they want to help to move more.
That's great. I'm really pleased to hear we're doing stuff in-house, but I love the idea that the networks within the council doing their own thing, bringing together teams. And, you know, if you're going to be really sort of corporate about things and take it out into, you know, big businesses, it's very good for staff teams to be doing stuff together. It really helps in the workplace afterwards if there's a little push to get our business partners on board with that. Karen?
Thank you. So, you wouldn't be surprised for me to say we also run a significant number of initiative and events. We have a regular Wellbeing Week with a timetable of events that take place that range from support for mental health, physical activity, etc. We also have, as a social enterprise, we also give our staff 3 days a year where they can go and volunteer however they want to, and we allow them to do that. Their, you know, whatever they want to go and do. There are a number of local organisations who come to us, and so we have a list where people can choose what they want to go and do. People do go and do things themselves. The teams are really good at being active themselves and going and organising things themselves. And we also encourage quite a lot of walking type meetings. We did quite a lot in COVID, and people found that really, really positive for their mental health and well-being as well. So a lot going on. The staff are in control of it and tend to drive a lot of it themselves and come with suggestions and requests. We also have a colleague fund where they can come with suggestions, and if it needs a little bit of financial leverage to set something up, that's available for them to do that together too. Thank you.
That's great to hear too. And Vicky?
Yeah, and I don't want to repeat what everybody's saying, but again, being the health service, you'd expect us to have a range of things in there, and we do have a range. So we have from Employee Assist, which does lots of different things, to our mental health first aiders, so we advocate and support people to train in that. We do lots of the volunteering type work and get people to do that, but one of the things that we have tried to do with the volunteering is keep it into local communities as well. So we're actually giving back into the community and doing that as teamwork. I think it's important to say we do the movement, so we advocate people not necessarily doing physical exercise but getting more movement, which is what you were saying, and from COVID that has carried on across a significant number of the teams is the walking meetings, so that's been a really crucial one. So there's lots of things going on, lots of things that we build up, and because of the organisational turmoil we're in at the minute, we are actively promoting all those things again and making sure people recognise them. And again, because the weather's picking up, making sure that people get out, take their lunch breaks and use it productively. And then on a wider scheme, not just in Kirklees but across the West Yorkshire, they're currently doing the Cycle to Work review and promoting that again and looking at what the uptake has been, etc. So there's work both locally and then on our West Yorkshire network going on with this.
Well, it's great to hear that there's structured and organic activities going on that are not just about playing sport or moving even, but socialising, interacting, even getting outdoors. I mean, I remember, you know, primary school would take you out under the tree and you'd have your afternoon class outdoors. You know, just being outdoors and being together can be enough to promote health and well-being. So that's great that we've leading the way, and anything else that you are doing innovative in your businesses stroke entities, please do share. Again, that's something that we can often learn from each other on. Item number 8 now. We've got the annual report, Kirklees Safeguarding Children's Partnerships, and I have Julie Sykes, the independent scrutineer, here with us. Thank you, Julie.
Thank you, Chair. You're asked to note and accept the annual report for Kirklees Safeguarding Children's Partnership, which has been shared with the meeting papers for today. The report itself outlines the milestones achieved and the ongoing challenges faced during the reporting period April 2023 to March 2024. You'll note that Kirklees partners aim to provide high standards of safeguarding, fostering cultures of continuous improvement underpinned by ambition and innovation. While each partner retains its own existing lines of accountability for safeguarding and performance monitoring, how the partnership works as a whole system is of crucial importance. The partnership are committed to a strengths-based approach, learning from work that's been successful in safeguarding children and the risks they face, as well as reviewing and reflecting on poor practice to facilitate improvements. Because of this, there's been a continued focus on shared responsibility and learning across all the partnership priorities. Highlights in terms of volume of cases dealt with indicate that 2023-24 was a busy year. The front door dealt with 17,608 initial contacts and 1,499 early help assessments were completed, linked to 690 families. There was also a steady increase in the number of children looked after, rising from 604 in 2021 to 838 in 2023. The number of 16 and 17-year-olds who were not in education, employment or training remained positive for Kirklees, with rates well below those recorded for England and the Yorkshire and Humber region. During the reporting period that's been covered, the partnership focused on 4 key priorities, each supported by a subgroup who've developed action plans and taken responsibility for delivering against agreed actions. Priority number 1 is tackling child exploitation and serious youth violence. The work of this subgroup aims to reduce the level of risk and harm caused by exploitation and violence for those young people who've been identified at risk, delivering positive outcomes to protect, prevent and support young people and their families, and reducing peer-on-peer violence, with a specific focus on bladed weapons. This priority is unusually covered by 2 subgroups, both strategic and operational, reinforcing the importance of the work and the need to make an impact. The subgroups have spent much time and effort developing the first partnership exploitation profile. This has been supported by all partners who've contributed by providing their own agency data, enabling a rich picture to be obtained and analysed, assisting in the identification of local risks and threats, including the identification of key locations where focused multi-agency activity is required. Through training and awareness raising, there's been an increase in the understanding of links which exist between young people who go missing and the link to exploitation and serious youth violence. Tangible links have also been made with education colleagues who are now represented and contribute to the subgroup's work, leading to an increase in the number of referrals for support to the exploitation screening panel and consistent contributions of intelligence through the Partnership Intelligence Portal. Over the last year, the group have been looking at ways the problem profile can be managed to ensure that learning is identified and acted upon quickly, using practice learning events, bespoke training, and bringing in subject matter experts. Priority number 2 is enhancing the emotional well-being of children and young people. The work of this subgroup focused on ensuring that all schools, colleges and universities have a post-pension offer built into their bereavement policies to support healing and reduce risk after a suicide death. They've worked to ensure that where the death of a child is suspected to be completed suicide, that a public health lead for suicide prevention is part of any review process so that the links to prevention can be strengthened. The subgroup have developed an anti-bullying policy for Kirklees, and through this work it's hoped that more young people will reach out to discuss their concerns early to enable support mechanisms to be put in place before they reach crisis point. During the reporting period, the subgroup have continued to develop their core membership and have expanded their governance arrangements by regularly reporting through progress into the Wellbeing Starting Well board arrangements. The subgroup have redesigned the emotional wellbeing and mental health services for children and young people. Through a baseline consultation with 362 children, a new model of Kirklees Keep in Mind programme has been launched. The group have also been keen sharing information about services and developments to support schools with issues such as gender identity, support for young carers, and a new Yorkshire Sports Welfare Officer to support community providers with safeguarding systems. Digital-based tools have also been developed for primary schools, including the My Happy Mind app. The next reassurance report will include details of the Children and Young People's emotional wellbeing strategy and insights from stakeholders, including children and young people. Priority 3 is promoting healthy relationships. This subgroup has focused much of its efforts engaging with educational settings, supporting them to tailor their approach to what analysis indicates are the risks to children and young people in their areas. They're helping education settings to develop a culture where children and young people feel able to disclose when they've been exposed to harmful sexual behaviour, creating environments where harmful sexual behaviour cannot thrive, and all kinds of sexual abuse is recognised and addressed, and importantly, ensuring that any young person who has experienced harmful sexual behaviour feels that they're supported by a range of professionals after the incident. During this reporting period, the report also covers a subgroup have worked with the Our Voice team to evaluate the impact of the initial work done linked to the Everyone's Invited agenda to identify gaps in provision. The update on this work will again be included in the next reassurance plan. Designated safeguarding leads in schools have been offered training on the updated Ofsted review of sexual abuse in schools and colleges, and scoping has been undertaken to understand what is available in terms of training and resources from agencies across Kirklees. This has identified that a significant amount of training offer is available to education providers from a range of community partners. There is, however, a recognised gap in support available to alleged perpetrators of harmful sexual abuse. The subgroup will be working with the early support team to look at if and how the shortfall can be addressed. Analysis of feedback from schools and the Violence Reduction Unit will also inform future priorities for this subgroup work. Priority number 4 is identifying and reducing the impact of neglect on children and young people and achieving the offer of early support for children and families. The work of this subgroup focuses on the help which is needed to ensure that children are able to live in safe and supportive families. This includes understanding the support which is needed to enable young people and families to be resilient and able to identify their own problems before they're in crisis. It's also about ensuring that young people and vulnerable learners have access to a range of opportunities for learning and developing their skills from early years through to transitioning to higher education, in particular improving the outcomes for children and young people who have special educational needs and disabilities. The subgroup have undertaken a substantial piece of work developing a refreshed neglect strategy alongside a toolkit to be used by frontline practitioners. Delays were experienced in finalising this product, but the strategy and the multi-agency training package are now ready. As part of the Supporting Families funding agreement, the group reviewed the Early Help System Guide prior to sign-off and submission to the Department for Education. They've also worked on raising awareness of Supporting Families programme, including the required outcomes across a wider safeguarding system, in addition to the development of the Kirklees Families Together offer, which acts as a holistic knowledge base for families in North Kirklees, helping children, parents and young people to discover the services they need most in their local area. The refreshed assurance report will detail how the subgroup have refocused their work in line with the Starting Well board as well as how they've continued to develop the Starting Well and Families Together strategy and partnership. Moving forward, the subgroup will also be reviewing recommendations from the Kirklees self-assessment undertaken as part of the Department of Education Early Help System Guide, which outlines a national vision for a mature early help system that is shared by the Department for Levelling Up, Housing and Communities and the Department for Education. The self-assessment tool was used to support discussion, reflection and action planning structured into 5 sections focusing on family voice and experience, workforce, communities, leaders and data. In respect to the voice of children, you'll note the report also includes significant feedback from children, young people and their families, articulating their own views about the services provided through the Kirklees Safeguarding Children's Partnership and how it's positively impacted on their lives. The back end of the report, you will know, also covers work from other subgroups, including the Safeguarding Effectiveness Group, Learning and Development, Child Death Overview Panel and the Policies and Procedures and Guidance subgroups. Thank you, Chair.
Thank you, Julie. A lot to absorb there, but you do have a full report in your agenda. So can I ask the board to note and endorse this annual report, please? Yes. Yeah. Our next item, Kirklees Safeguarding Adults Board Annual Report, will be from Jackie Stansfield, our Adult Safeguarding Lead, and she's on Teams. I think she's appeared on there. Thank you for joining us, Jackie.
Hi everyone. My name is Jackie Stansfield. I'm the Service Manager for the Kirklees Safeguarding Adults Board. Unfortunately, Rob McCulloch-Graham, who's the independent chair of the board, wasn't able to make today. So any questions that you may have for him, I'm happy to send on, but equally try and answer myself. So I'll just share the presentation. So, as advised, I'm here to go through the findings of the annual report. The annual report's already on the Kirklees Safeguarding Adults Board web pages. As in previous years, you know, there's been significant challenge across the partnership with the economic difficulties which continue to impact on our communities and the resources reductions that are available to support them. So what we do is look at how we can work better together to overcome financial challenges and maintain both prevention and intervention work for services. And without the partnership work that the report will go through, the adults and families with care and support needs in Kirklees would have been facing further significant health and social care difficulties. So the annual report showcases how we've worked against the strategic plan shared objectives that are agreed across the partnership. So the Kirklees board vision is to work together to take action to keep the people of Kirklees safe from abuse and neglect, putting people at the heart of everything we do. One of the things that's absolutely paramount is the making safeguarding personal. So it's working with that person through every intervention and every step of the journey. So we work towards the 6 values of the 6 safeguarding principles, which is empowerment, prevention, proportionality, protection, partnership and accountability. So again, like I said, working together, supporting adults to make safer choices within their chosen lifestyle, working together to take steps to prevent or stop abuse and neglect, ensuring we have a confident workforce which are able to respond to the safeguarding matters, and promoting the public as a key partner. So as a board, we do that through leadership, protection, prevention, learning and seeking assurance. And we have a variety of subgroups that enable us to do that, which is the quality and performance subgroup, the safeguarding adult review subgroup and the learning and development. So we have a 3-year strategic plan, and the report from 23-24 showcases what our share objectives were at that point. So those were to support the workforce, ensuring that the staff had enough knowledge and skills necessary to carry out their role. We continuously learn from experience, so that might be looking at previous reviews, looking at the data in the quality and performance subgroup, and continue to evaluate feedback and looking at how we can improve working together across the partnership. We continue to strengthen the works with all the organisations that sit across the Kirklees adult footprint, working together to produce strategies, and we also have each organisation completes a self-assessment which feeds into the early challenge event, and we work together to do joint learning, and we will also explore ways of harvesting and sharing stories of the people that we work with. So this is people with direct lived experience. We're always looking at examples of good practice and areas which might require improvement to continue ways of improving working. So back in 23-24, part of the learning and development subgroup, we were looking at different ways of shared learning. So partners, you know, work different shift patterns. You know, we have low-carla nurses, hospital doctors, nurses who may need to access this information. So we're constantly looking at how we can reach people at different times. We're very much aware not everyone works 9 to 5. So we've expanded fact sheets. We source more case studies, but it's a good source of learning. We've produced some animations and short films. So they were procured via other boards, and they were hidden harms around domestic abuse in older people, what to do about self-neglect, and tricky friends, which looked at mate crime. So the short films that are really useful for staff for those areas. So as part of the learning and development offer, we include a variety of learning materials and different sources of resources that staff, both staff and volunteers across the partnership, can access. So the areas that we looked at in 23-24 was around transitional safeguarding, mental capacity, professional curiosity, trauma, civility and respect, and support and advice, and the development of carers and young carers. We also looked at some safeguarding resources for adults in faith-based organisations. As part of reaching out to the partnership, we complete a variety of network events. One of those was around navigating the careverse. Now, this was looking at unpaid carers, so staff who may be working in the Kirklees partnership in any of the organisations who may also have a caring role, so how we can support those. So Carers Count came and delivered some sessions for us and showcased their offer. We did a network event around the Mental Capacity Act. The aim was to demystify some of the mental capacity concerns that staff have, and how that can be used to support people, looking at how a person's able to act on that decision, so the executive functioning part of the Mental Capacity Act. And we did that as a face-to-face event, and we invited a variety of different partners who had market stalls, so there was a good opportunity for networking and people to be able to ask questions of the experts that were in the room. So as part of the groups, the board subgroups, is we continuously reevaluate the work. In those, we will review and amend any policies and procedures, looking at feedback from practitioners and people with lived experience. As part of, it is actually a national piece of work, but we did it locally. So we joined forces with colleagues from communities and the Children's Safeguarding Partnership and pulled together a task and finish group looking at how we can effectively embed learning from the reviews. So looking at the recurring themes coming out of the safeguarding adult reviews, the domestic homicide reviews, which have now changed to domestic homicide related deaths, and the children's practice reviews, and looking at how we can really make sure that the learning reaches frontline staff. So again, looking at different ways to disseminate that learning by producing videos, storyboards. We've developed some resources that can be used in supervision, so it allows that conversation and to look at different scenarios of cases to see how a practitioner maybe have dealt with those. We look at where there might be gaps in practice, where we've identified specific reoccurring themes. And one big piece of work that we feed into is the Regional Safeguarding Week offer. Now, we do that with colleagues from Leeds, Calderdale, Bradford, Wakefield, and us, and staff across the regional footprint can book on any of the courses. So we make sure it's far-reaching, and because people work different patterns, like I said, they can book. We each have a day where we might be doing specific things for the region. And we also carry out multi-agency audits after if, for example, if a policy is being put in place, we review that after 12 months. So as I've already touched, we did a lot of work around mental capacity. We actually had mental capacity task and finish group, which again was the 3 boards working together. So that was looking at solutions to enable how we can embed learning, specifically around mental capacity, because the Mental Capacity Act is from 16 and above. So we worked together looking at how we could collate stories and share the learning across the partnership. So that's just talking about Safeguarding Week, which I've already gone through. So as well as the work we do locally, myself as a board manager, I sit on the regional and national meetings. So I work with the Yorkshire and Humber colleagues in ADAS and the LGA, and we strengthen links and work closely with board partners to make sure that we're working as effectively as possible. We carry out a board challenge event annually. We're actually in the middle of one this year, where each organisation completes a self-assessment, and we have then a conversation to see how things have been over the last year. As part of the Quality and Performance Group, we request an agency highlight that makes sure that we're getting data from across the partnership and not just the local authority in relation to the Section 42 duty. So that's when the safeguarding concerns, when there's an allegation of abuse or neglect, because it's led by the local authority, we gain the data from that, but to make sure that we're looking at the partnership, we get an agency highlight report so that that's looked at collectively. We're very fortunate in Kirklees to have the Care Home Early Support Programme, and that feeds into the Quality and Performance Group as well. So as advised, there is real strong partnership working across all of the 3 boards. We have representatives from various parts of the Communities Board who sit, and Children's Board, who sit on our boards, and it's shared for those subgroups as well. So as well as the Kirklees Safeguarding Week, there is a National Adult Safeguarding Week, which is usually run around November. So there we will also share different activities and resources, allowing staff to focus on safeguarding for a week and seek some further learning. So as advised, we're currently in the challenge event for 25, where we look at the performance, and we also then collate where there might be gaps. Partners are saying we need maybe some priority areas to focus on moving forward. So back in 24, the themes that were kind of coming from challenge, from our quality and performance data, from discussions with practitioners, the areas that we needed to focus on were transitions, domestic abuse, working with families and households, community work and community networks, and then dealing with the resource reduction, capacity reduction as well. So those are what we're looking at now. So if anybody's got any questions, happy to answer them.
Does anybody have any questions for Jackie? Thank you, Jackie. That was really interesting. I was delighted to hear about the lived experience work and partnership work, and how your networking and has keyed into the challenges for unpaid carers particularly, and these new ways of sharing learning. Has anybody got any questions for Jackie? No, I think you've filled us in nicely there, Jackie. Everybody's all up to speed there. I'm looking forward to your focus for the coming year. There's some really important stuff you're doing there. Thank you. This is just for the board to receive. So it's received. And thank you very much, Jackie.
All right, thank you everyone. Bye.
So, although we've come to the end of the formal part of the agenda, there's a couple of things I just want to say before we finish for the day, and we're finishing nice and early. For people who were here just before the meeting, we were able to join a retirement presentation of Len Richards, who is, or was, or just about to be the Chief Exec of the Mid Yorkshire Acute Trust, and he's been a member of this board. So we thank him very much for his work with us here and in the wider health sector. But we've also got another retirement that's happened since our last meeting, and that was of Carol McKenna, the ICB Chief Executive here. And she's been with the Health and Wellbeing Board since its inception in 2013. So I really want to thank her for her invaluable commitment and contributions to the board and the wider health landscape. And we wish them both the very best in their retirement. And that concludes today's meeting. Thank you.